Hello guys, my name is Kartika Pratiwi from class B. So here I will expose the nursing care who I have created. Then the case I took was the nursing care a grieving patient. So we got one case here where a wife lost her husband in an accident. So I will read the case. In a village in the city of A, there is a husband and wife who have only been married for 1 month. The husband's name is Arza and the wife is Ningrum. One day, Arza had an accident that resulted in Arza's death. Ningrum's mother said that his made Ningrum feel very sad. She kept crying, did not want to eat and left the room. She shut herself up and looked at Arza's photo. She rarely spoke and sometimes shouted Arza's name. She often said that she could not believe that Arza had left. Besides that, she often woke up and cried loudly for Arza. When the assessment Ningrum's look weak and the face looks wrinkled. So I already make examination. There is identity, name Ningrum, age 32 years old, gender female, address Mawar Street, and religion Islam, job housewife. So I have main complaint. Ningrum felt very devastated after her husband died. She kept crying, didn't want to eat and left the room. And now complaint is Ningrum said that this made Ningrum feel very sad. She kept crying, didn't want to eat and left the room. She shut herself up and looked at Arza's photo. Become really talked and sometimes often shouted Arza's name. And this is data focus. So the data focus is divided into two, namely data subjective and data objective. First, I will mention the data subjective. The client's mother said the client very devastated. She continued to cry, did not want to eat and left the room. The client's mother said the client often shut herself up and looked at Arza's photo. And the client's mother said the client rarely spoke and sometimes shouted Arza's name. The client said that she couldn't believe Arza was gone. Nonetheless, the client says that she often wakes up and cries loudly calling Arza. And the next is data objective. So the first one, the client look clean, face look wrinkled. The client looks hopeless and sad. The client has difficulty concentrating when the nurse asks. Abaches appear. And the vital signs. The first is temperature 37 degrees Celsius. Pulse is 75 times per minute, and blood pressure 120 per 80 mmHg, and respiratory to 24 times per minute. And the problem is grieving, with the diagnostic number is D0081. And then we move on to intervention. So grieving, key intervention, grieving process support. The first one is identify the grieving process experience. Show acceptance and empathy, motivation to want to express feelings of loss, facilitate expressing feelings in a comfortable way, discuss coping strategies that can be used, encourage identifying the greatest fear of loss, and the last stage, through the grieving process gradually. And we have implementation. The first, able to express feeling of grief, explaining the meaning of loss. Clients can express their anger verbally. Clients can be overcome their anger with adaptive coping. Client can identify guilt and feelings of fear. The client can identify the level of depression. A client can reduce guilt. Clients can avoid self-destructive action. A client can accept loss. And the last is clients can socialize again with family or other people. So the presentation of nursing care that I explained has been finished. Hopefully it will be useful for all of us. Thanks for watching. Thank you for your attention and bye.